Today on Investigate TV Plus, childbirth emergency.
It was terrifying. Like, here we are in the middle of nowhere.
Some pregnant women in rural America have to drive hours just to deliver their baby. But one university healthcare system is exploring an innovative solution to change that.
I think we're part of the answer. We do our best to work with our rural facilities to say, how can we assist you in this work?
We go in depth with providers working to improve access to care, examine why more rural hospitals are closing obstetric units. Plus, a family in a race against time shares their frightening experience.
Then, beauty and its beast. Hairstylist and nail techs exposed to potentially harmful chemicals now face a grim outlook. We speak to a retired salon worker battling a host of health problems and examine popular hair products at the center of concern.
And at a time when many people are stepping back, a Vermont woman is stepping up.
I think when you're old like me, it's good not to sit around.
The energy and inspiration behind a life lived in full motion.
In-depth stories that inform and inspire. You're watching Investigate TV Plus. Countless pregnant women in rural America face an urgent situation finding a hospital to deliver their baby. I'm Tisha Powell.
And I'm Lee Zurich. Since 2020, more than 100 facilities have stopped delivering babies. And as of 2024, 5.5 million women live in dangerous maternity deserts. Now a university health system is training rural hospitals to handle emergency deliveries even if they don't have maternity wards.
Reporter Kristen Crowley explores a program working to keep mothers and babies safe and shares one family's desperate race against time.
So we are northbound on 169 highway. Sir?
For Danielle and Riley Redenbaugh, even after 2 years, memory hasn't gotten any easier.
Have you listened to the 911 calls?
We listened to it once. It's rough.
We cried, both of us did.
Pregnant with her third child, Danielle was no stranger to birth plans. But on this early morning in February 2024, nothing went as expected.
It was terrifying. Like, here we are in the middle of nowhere.
Danielle's water broke at 3 a.m.
The pain just wouldn't stop, and I was like, we have to go now.
The Redenbaughs got on the road as quickly as they could,
Starting route to Olathe Medical Center.
but they live about 30 minutes from the nearest hospital with a labor and delivery unit. It was just too far.
I pulled the car over to the side of the road, ran around the front of the car, and when I opened the door, his whole entire head was out, looking at me. So,
You had to essentially
yeah.
deliver your own child.
It's me.
But the exciting moment quickly turned to panic.
It's not breathing! Yeah. Okay, he's having a hard time breathing.
I was just like, I don't think he's gonna make it, and nobody was coming.
It took medical responders 11 minutes to arrive. They were able to stabilize baby Frankie, but things could have gone terribly wrong. The Redenbaughs live in what's called a maternity desert, a county that lacks maternity care services.
There have been a significant number of obstetric units closing in rural hospitals in recent years.
Healthcare policy expert Harold Miller says many rural hospitals can no longer afford to offer maternity care. It's especially pronounced in Kansas, where only about a third of rural hospitals still deliver babies.
When you lose maternity care in the community, you significantly increase the risk of problems for both the mother and the baby.
Wherever you show up needing care, you should be able to expect the same level of high quality care.
Jody Schmidt of the University of Kansas Health System says they're working to make sure rural hospitals are ready for whatever comes through their doors.
We want people to know if you come in with a heart attack, you come in with a stroke, you're a maternity patient presenting to a rural hospital that hasn't delivered babies in 10 or 12 years, that team has the best practice recommendations, has had the training, is there to meet your needs in that time.
Their patient safety organization called the Care Collaborative helps rural hospitals in Kansas stay up to date on the latest standards of care. In fall 2025, they launched their newest program to support maternity care.
We got involved with the obstetrical side of things just because of the increasing loss of delivery services in a number of our rural communities.
Care Collaborative Medical Director Dr. Robert Mosier and his team travel to emergency rooms across the state to offer the in-person instruction.
The fact that fewer sites are delivering, the likelihood at some point in their career they'll have to manage a delivery will go up.
The training is free to dozens of hospitals across the state that have partnered with the Care Collaborative. Everyone from physicians to nurses to EMS personnel can participate.
We really want to arm folks so we can have the best possible outcome because, as you know, maternity can be a high-risk situation.
Can this be the difference between life and death?
It absolutely could be the difference between life and death.
Kingman Healthcare Center is a 25-bed facility 45 miles outside Wichita. It hasn't had a labor and delivery department since 2006.
If they show up at their doors, we have to treat them.
Nursing director Marissa Gehring says they requested the training to brush up on skills that much of the staff hasn't used in years.
They've been having contractions.
That's really the challenge, is you kind of do a little bit of everything and you don't have all of the capabilities that a large facility has.
A bag of water broke just before we came in.
How far along is she?
She's 38 weeks.
The 4-hour training has a heavy focus on hands-on simulation.
She's going to start pushing.
Healthcare workers learn how to assess a laboring patient.
Bingo. Out comes the baby.
And handle high-risk situations.
We're going to give you a frank breech.
Pregnant patients do come here and they need care and they need it emergently.
But one day of on-site rural boot camp can only go so far.
What we're trying to do is separate the placenta from the uterine wall.
The Care Collaborative also provides support tools, along with remote and in-person follow-up visits.
We know from our other trainings that confidence level goes up, the retention is much better.
Miller says he wishes a program like this didn't need to exist, but patients will be better off because it does.
If the labor and delivery unit in the hospital closes, it's a pretty safe bet that some women are still going to be coming to the hospital in labor and needing assistance.
We can't continue to see more and more rural hospitals close without an answer to how do we continue to deliver care.
Is this the answer?
I think we're part of the answer. We do our best to work with our rural facilities to say, how can we assist you in this work?
You want to read, bud?
Danielle and Riley say they know how lucky they are.
Mama Loma with Mama.
Not only to have Frankie, but each other.
Probably like a day later, he was like, Danielle, I didn't even think about the fact that you could have died.
Is that hard to think about now?
Yeah. I'm an emotional one.
Yes, he's a very emotional one, yep.
They hope by sharing their story,
His birth certificate says the highway.
other families might be spared that same nightmare.
Maybe there was a bigger reason for it to happen this way.
Because in rural America, access to care shouldn't be a matter of luck.
In December 2025, the federal government launched a $50 billion rural health transformation program that provides funding to all 50 states. The goal? Modernize rural health care, enhance workforce sustainability, and improve access to care.
Kansas partnered with the Care Collaborative to develop this plan.
Still to come, this rookie investigator may not wear a uniform, but she definitely has a nose for solving crime.
Good girl.
We introduce you to the newest addition to an Arizona fire department and show you how she's helping get to the bottom of suspicious fires.
But first, the cost of beauty.
No one ever said this is not good for you.
Some hairstylists are paying a high price after years of exposure to potentially harmful chemicals. We examine dozens of complaints and hear from lawmakers pushing for a solution to make salons safer.
Their job is to help men and women look their best, but salon workers risk daily exposure to dangerous chemicals in the name of beauty.
Our investigation found years of research and complaints involving potential issues with products marketed to people with curly and textured hair, an issue that disproportionately impacts African American women. A study released in February 2026 found the same chemicals in plastics, pesticides, and flame retardants are also present in some wigs and hair extension products marketed to Black women. According to the study, 41 out of the 43 products tested contained a hazardous chemical, and that threat goes beyond wigs and extensions. Chemical hair relaxers also pose a risk.
Investigative reporter Carice Jackman examines the hidden dangers lurking in salons and explains why workers are bearing the biggest burden.
For 35 years, Georgie Golden knew the ins and outs of the salon.
And you knew that when you were done, man, I looked like $1 million. And I didn't even have to go buy a new outfit.
She remembers when the biggest sellers were relaxers. When you heard about that study, what did you think?
My first thought was, that really couldn't be us. And then you start thinking, well, you know, we had some friends to pass, but we never knew what they passed from. So we just chalked it up that they were sick.
What she read was a 2022 sister study, research led by the National Institutes of Health that showed a correlation between formaldehyde and uterine cancer after following women for almost 11 years.
No one ever said, hey, this is not good for you. Even though you know formaldehyde is used for embalming.
Georgie herself has had health problems over the years that she's wondered about. After developing polyps, she had a hysterectomy.
When were you diagnosed? And it's lung cancer, correct?
Yes. This past April, I was diagnosed.
Lung cancer, which has been associated with some chemicals used in nail and hair salons.
I forego drinking, I forego smoking, and then I became sick and I wound up with cancer. And I was like, I didn't do anything. How did this happen? And then had to start going back through the times. Yeah, I did nails. Formaldehyde was right there.
We asked the Occupational Safety and Health Administration, or OSHA, for a copy of all complaints submitted to the agency about formaldehyde dangers affecting hair salon owners and workers over the past 5 years. We received 40 complaints from across the country and noticed a pattern coast to coast. Several owners and employees complained about the lack of ventilation within their salons. Some expressing concerns about not having safety data sheets about those chemicals.
And never once did an inspector say, what we're breathing in is toxic.
Not once.
One OSHA hazard alert showed and investigated a series of Brazilian blowout products, finding some were listed as formaldehyde-free. But on-site testing showed they indeed found formaldehyde in the air.
These chemicals in these hair relaxers have proven to be dangerous.
Congresswoman Shontel Brown and some other lawmakers are not only calling on the FDA to ban chemical hair products like formaldehyde, but are also pushing for additional legislation to study uterine cancer and other illnesses related to chemical hair straighteners.
We want people to be able to beautify themselves without worrying about if this is going to give me any adverse health effects.
On a state level, California, Washington, and Maryland have banned or restricted formaldehyde in cosmetics.
But we definitely, given the number of people who are impacted by it, should have more resources put into researching this.
Back at home, Georgie is retired and doing her best to stay healthy.
We as women of color, we want to have the image that they have said we should have. And as they said, beauty costs, and we are paying the cost for that beauty.
Still ahead, she fills her days with color, creativity, and movement.
My dancing is keeping me healthy.
We introduce you to a woman inspired to embrace new passions while proving it's never too late to try something different.
But first, she doesn't suit up in gear, but her nose might be an Arizona Fire Department's best tool yet. We show you how a special canine helps investigators sniff out a potential crime. While many dogs are beloved companions, others are specially trained for critical work like detecting crimes or assisting people with disabilities.
Kennel clubs and dog breed organizations categorize these breeds into what's called a working group. For example, Labradors and Golden Retrievers make excellent service dogs. According to Canine Companions, the breed's intelligence and friendly nature make them highly trainable for daily tasks, like opening doors and putting on socks. Another type of working dog possesses an exceptional sense of smell, and some are trained to detect accelerants at fire scenes.
Reporter Jason Berry introduces us to a yellow lab helping an Arizona fire department sniff out crime.
There's a new member of the Gilbert Fire and Rescue Department, but she doesn't drive a truck or wear all the turnout gear. This firefighter works on all fours and lets her nose lead the way.
Come on, get it.
Playing ball in the park is one of this yellow Labrador Retriever's favorite activities.
She's just like any other house pet. You know, she's a lab. She loves people. She loves playing with other animals.
But there's a lot more to Xanadu than fun and games.
Show me. No, show me.
This dynamic dog has a job working for the Gilbert Fire and Rescue Department, helping arson investigators determine whether a blaze was deliberately set.
When we go on a fire scene and everything is burned and charred and water's been put on that fire, she's able to search that area and she'll alert to where ignitable liquids are. Yes, good girl.
Twice a day, 7 days a week, Xanadu is put to the test with a room full of clothing, cardboard, and cans.
Yes.
Her job is to locate items with traces of flammable liquids.
Tell her the command seek, and she'll put her nose down and she'll start to sniff, and we'll systematically work in a pattern to cover that scene.
These are photos from Xanadu working actual fire scenes across the state. The proficient pup has been on the job since October after going through 12 weeks of training with the U.S. Bureau of Alcohol, Tobacco, and Firearms. Every year, the ATF converts dozens of dogs into accelerant detection canines that join up with fire agencies across the country. Xanadu is now the only ATF accelerant detection dog in the state, replacing Gilbert's last fire dog, Zeta, who recently retired.
Good girl.
There's 6 classifications of ignitable liquids that Xanadu alerts to, and those cover dozens of products that people would use to start a fire. So I have a question. Does Maple Zurich have a job like that?
Maple Zurich does not have a job like that. Maple Zurich's job is just to run our house and be in charge and do whatever she wants to do. She has a powerful nose, though.
And be cuddly for cookies?
Be cuddly, yes, yes.
A nose for cookies.
Nose for cookies and treats and any type of food that humans eat.
Good enough.
Exactly.
Up next, she's taking the wheel and living life at full speed.
117 miles one way.
We reveal the drive behind this woman's unstoppable energy. From canvas to the dance floor, this 87-year-old doesn't shy away from a creative or personal challenge.
Following the death of her husband, Judy Tuttle realized she could build something positive for her community.
Reporter Joe Carroll reveals what inspires this multi-talented artist to make a difference.
Judy Tuttle has an eye for detail.
So right now I'm trying to match that group and this group.
She's hanging art for a show at the Charlotte Senior Center. Judy's the curator for the center.
And if I move that one, I have to move this.
She finds the artist and hangs the painting with her friend Katie Franco.
And then they have to be all level.
Judy doesn't just install art, she creates it.
Almost everything that I do is of water of some sort.
Her work is in a side room at the center.
You give away your paintings?
Yes.
It's fair to say you keep pretty busy.
I want to. Yeah, I think when you're old like me, it's good not to sit around.
At 87, Judy dances through life.
And you also like ballroom dancing.
Love ballroom dancing.
So once a week, she gets up bright and early and travels to Montreal for lessons.
117 miles one way.
Judy's been contently twirling and moving in her 2-inch high heels with Salve Traiteur, a Canadian national champion.
You can't just dance with anybody and have them be able to do that. I think that my dancing is keeping me healthy.
Judy would learn to dance and paint while she was a student at Middlebury College. And that's where she met her future husband, Fred. Fred would become a teacher and eventually the superintendent of schools in South Burlington. However, their world changed in an instant.
Was he sick for a while?
6 months. He learned that he had a cancer around Christmas, and he died in June.
After that, Judy would also question her own mortality.
I wanted to do something for the world like he did to make it a better place.
Judy, a special educator, decided to start a school for troubled boys.
Now, these kids who came in had been asked to leave public school.
Hallcrest School in Burlington was an independent school funded by the state.
They followed my rules because if they didn't, I said, well, then you're going to have to go back to public school.
Their classroom was the world, opening their eyes to new ways of learning and thinking.
So in Italy, they could actually see a volcano.
And at 59, Judy would even learn to snowboard with the kids.
I fell and fell and fell. On the other hand, I needed to do that with all the kids for all the years that I had the school.
She has since retired from the school and the slopes.
That's the start to my waltz routine.
But the dance floor is still music to her ears. Along with her passion for painting, just a brushstroke away.
And that is just about right.
And that's it for us on Investigate TV Plus. I'm Lee Zurich.
And I'm Tisha Powell. Thanks for watching. On the next Investigate TV Plus, some parents say their children with disabilities are being denied school services required by federal law.
Fayette County might be a great school district for the overachievers, but they stink at the special needs kids.
We follow one father's fight and reveal where we found a rise in complaints in recent years.